Hello, I'm Dr. Sofia Kuznetsov with Norton Heart and Vascular Institute. An electrophysiology study, also known as EP study, is a test used to evaluate your heart's electrical system and to check for abnormal heart rhythms. The heart's electrical system produces signals that control the timing of your heartbeats. An EP study gives us a detailed look at how electrical signals move through your heart. EP study may be recommended for several reasons. If you have an abnormal heart rhythm called arrhythmia, such as supraventricular tachycardia or any other type of tachycardia, an EP study can help to determine the best treatment. If you have a sudden loss of consciousness, also known as fainting or syncope, an EP study can help understand the cause of it. If you have certain heart conditions, an EP study may be recommended to better understand your risk of sudden cardiac death. An EP study is always done before cardiac ablation to pinpoint the area of an abnormal heart rhythm. The EP study is performed in electrophysiology laboratory of the hospital, where you'll be placed on an X-ray table. You may be given medications intravenously to sedate you or to make you sleepy, and these medications help reduce your anxiety and relieve your discomfort. Your groins will be cleaned with antiseptic, and sterile drapes will be placed to cover your body. A local anesthetic will be administered with a tiny needle to numb the area where the catheters are inserted. You will feel a pinprick and possibly a stinging sensation for a few seconds. Small, thin wire electrodes will be placed through a vein in the groin, and those catheters will be guided to your heart using special type of X-ray called fluoroscopy. Once in the heart, the electrodes measure the heart's electrical signals. Electrical signals are also sent through the electrodes to stimulate the heart's tissue to try to cause the abnormal heart rhythm. Medications are also sometimes used to stimulate your arrhythmia. An EP study doesn't hurt, but you may feel uncomfortable as your heartbeat speeds up. If we identify an abnormal heart rhythm during your EP study, we may perform an ablation at the same time. Upon the completion of an EP study, the catheters are removed from your groin and a pressure is applied to stop the bleeding. Following your EP study, you'll be moved to a recovery area to rest quietly for 4 to 6 hours. Your heartbeat and blood pressure will be monitored continuously to check for complications. Most people go home the same day. Plan to have someone else drive you home after your test and to take it easy for the rest of the day. Be sure to review pre- and post documents on what to do before and after the procedure. As always, if you have questions, please reach out to your doctor's office. Thank you for choosing Norton Heart and Vascular Institute.